Good morning, my examiner. I am CAN number 001/021/56/25F. I am here for my practical examination.
Good morning, candidate. Please attend to this pregnant woman. She is already registered in this facility. Thank you, sir.
Good morning, madam. I am Favor Adaize, a community health student. I will attend to your complaint today. Okay, thank you. From your card, your next appointment is next week, Tuesday. So, what brought you to the health center today?
I never go toilet for some days now and it can't disturb my belly.
Your complaint is you are not able to pass stool for some days and your abdomen is disturbing you?
Exactly, ma.
When did the abdominal disturbance start?
At first, I stayed for 2 days. I didn't remember to go to toilet. 2 days later, I got worried and said I must come to the health center. But I do eat very well. I don't have any other issues.
And start. Is there any other complaint? Have you experienced this condition before or since this your pregnancy?
No, ma. This is the first time.
Have you taken anything or done anything to relieve this condition?
I only take my routine drugs you gave me. But these days, the drug can smell. Please keep on taking it.
Madam, I would like to examine your eyes.
Okay, ma.
Please stretch out both hands. Now I will examine your legs. Madam, I suspect that you are having constipation. It can happen during pregnancy, but it can be managed. You need to take more fiber-rich foods like fruits, vegetables.
Okay, ma. I will do that.
Please continue taking all the routine medicines we prescribed for you. Drink plenty of clean water every day. Get enough rest. Maintain good personal hygiene.
Okay.
Also, you need to eat more fruits like oranges, pawpaw, bananas, watermelon, ugu, and whole grains. These foods are rich in fiber, they soften the stool and make it easier to pass. And again, do not ignore the urge to pass stool whenever it comes, and please avoid straining. Like I said earlier, drink plenty of water. I hope you understand. And again, do not ignore the urge to pass stool whenever it comes, and please avoid straining. Like I said earlier, drink plenty of water. I hope you understand. Any questions?
Madam, during pregnancy, there are some danger signs you must never ignore, such as vaginal bleeding, severe headache, swelling of your face or hands, and also, if you notice your baby stops moving, or watery fluid leaking from your vagina before labor, if you develop difficulty in breathing or a very high fever, please come immediately.
Okay. Madam, please remember your next antenatal appointment is next Tuesday. Kindly come with the ultrasound scan I requested so that we can review the results. Thank you. Sir, I am done managing the patient.
What are unsaturated lipids and what are their clinical significance?
Sir, unsaturated lipids are fats that contain one or more double bonds in their fatty chains. They are usually liquid at room temperature and are found in foods such as vegetable oils, nuts, seeds, avocados, and fish. Clinically, they help reduce bad cholesterol, improve heart health, support brain function, and reduce the risk of cardiovascular diseases.
Explain how vitamin D contributes to strong bones in the body and mention 4 sources of vitamin D in the community.
Vitamin D contributes to strong bones. It helps the body absorb calcium. This comes from the intestine. It reduces the excretion of calcium. This happens in the kidney. When calcium intake is low, vitamin D also helps regulate the release of calcium from the bones. Sunlight, egg yolk, liver, fish, and fortified milk are some of the sources of vitamin D available in the community. Other main sources, like I said earlier, fish such as sardine or mackerel.
You can go.
Thank you, sir.